I get knocked down, but I get up again. You're never gonna keep me down.
Pick anyone? Dr. Williams, why don't you come up and join us? Well, it looks like we have much of a choice. You want to come up and join me, Gil? Good. Yeah. Dr. Schreiber. Dr. Reed. It's 1985. You're in a Best Buy warehouse in Topeka, Kansas. A crate falls on someone approximately 20 feet high. Ends up with a barbecue tong sticking in his left chest. Go.
A Best Buy warehouse?
Yeah, Topeka, Kansas, 1985. Go.
I guess first of all, I'd have somebody call 911.
On what telephone?
Just on the store telephone.
The manager's in the back. He's calling his mom long distance. So that line's tied up.
So I'd have somebody use their cell phone and...
It's 1985. There aren't any cell phones.
Okay. A warehouse. I guess I'd...
Come on, Matt. You know what to do. It's obvious he's got a tension pneumothorax. What are you going to do? You're going to put in a chest tube.
Okay, so I'd grab a chest tube tray.
Once again, you're in a warehouse. There's no chest tube tray.
Okay. Is there a vitals machine?
No.
Come on, Matt. Let's think about this. You're in a warehouse. There's things to use. Smooth. Can you pull up the Sony XP24 VCR recorder from 1985? That way we can show Matt what's going on here. So, Matt, it's obvious you didn't read about this, but you could take apart a VCR. This V-stopper rod here would work perfectly for a scalpel, be able to cut into his chest. There's an option for you.
So I guess I would use the V-stopper.
Stop. Stop. So, what's the scene look like?
So it's 1985.
Okay, just stop. I'll draw it for you. All right. Warehouse floor, crate, falling, patient, metal, pool of blood. Go.
So, like I was saying, I'd use the V-stopper from the VCR to make an incision in the right chest and place a chest tube.
What are you going to use for a tube?
Just a 36 French.
Where are you going to find a 36? Matt, remember where you are.
So I'd use the punch roller from the VCR to...
Stop. What about a washing machine? Do they have a bunch of tubes in the back?
Yes, sir.
Could you probably fit in one for whatever you needed, whatever length you wanted?
I guess so. Yes.
Okay. We'll wait for it. Dr. Williams seemed to be struggling a bit. So you decided that you're going to put a chest tube in this guy, correct?
Yes, sir.
So how are you going to go about doing that?
Oh, well, hey, so sorry, I walked in a little late. I didn't hear everything, but I heard chest tube. I'm thinking, Matt, you're looking to me like like 1985 warehouse scenario, right? Okay, so you're going to put a chest tube in this guy?
Yes, sir.
All right, and you know how you're going to do that? Have you ever done that before, Matt?
Well, not in a Best Buy warehouse.
Yeah, I mean, I think you know what you're doing, but tell me how you're going to do it this time.
Well, I guess I would prep the patient.
Before you do that, are you going to give the guy any anesthetic?
Well, I don't know how we could.
I mean, you try to go poking that chest tube in the guy without any anesthetic, he's going to just go, wow! All right, it's just not going to work, okay? The answer is yeah. You got to numb him up first. How would you do that?
I guess I would.
Are there things in the warehouse that you can use to make your anesthetic? The answer is
No.
yeah, there is. All right, did anybody in any of this mention going into the janitor's closet?
No, I hadn't really thought about.
Okay. All right. Can we put this up? Matt, you've been paying attention, right? You know what that is, right?
It's a chemical structure.
Yeah, I got. Okay, I see. You see the drawing. It's a chemical structure, but what chemical structure?
I don't know.
Okay, all right. This is ropivacaine. All right, this is something you use, so you have to know these things. All right. It's a dead giveaway ring structure. This enantiomeric form is definitely what you're looking at. Oh, okay, you got that. Remember this one, Matt. Okay, I'm going to ask you about this sometime this year. All right. I'm going to want you to draw that. Are there things you can use to synthesize this compound in a janitor's closet in your average Best Buy warehouse?
Yes.
Yeah, there is. All right. Take a couple of cleaners that he uses, along with some of the CD cleaner from the Best Buy CD area. They did have CDs in 1985. You know that, right, Matt?
Yes, sir.
All right. So you can get this. Okay. How are you going to inject that into him?
I guess I would use a syringe.
Yeah. Where are you going to get that?
I guess the.
Yeah. Are there diabetics walking around in just about every warehouse in the country back in 1985?
I suppose so.
Yeah. You just take anything that you want off of those guys and use it for your medical procedures. All right. How are you going to dress the wound?
I guess I would use some tape or something.
Yeah, the answer is you're already halfway there with this. Can you add one other thing to this compound and make your own dermabond?
Yes.
You can. All right. We'll go over that one later. Okay. All right. Sydney, you've been listening to this, right?
Yes.
All right. Good. Well, while I got you on the subject, what's the female population of Western Uganda?
I don't know, sir.
About 1 million, on that order of magnitude. But back to what we're talking about. What is the critical thing that Dr. Williams has missed thus far?
I don't know, sir.
Yeah, he hasn't talked about how he's going to make a pleurovac. Right? How would you make a pleurovac in 1985?
Well, am I me in 1985, so I'm like 10 or 11? Or am I me, time traveler, in 1985, so I'm me?
Sydney, stop. You. I don't know your name. I apologize. How old were you in 1985?
I wasn't born yet, sir.
Okay, Sydney, you answer that.
I was like 10 or 11, sir.
Okay, well, 10 or 11, did you understand Archimedes' principle?
No.
Well, then you wouldn't be able to make a good pleurovac, would you?
Sir, couldn't I just use a vacuum?
Yeah, I don't know. I don't know. Can we be done with this now? What do you think? Are we done? Yeah.
All right,
Yeah.
all right. Matt, under the circumstances, I thought you did a pretty good job.
Yeah, and a very reasonable use of available materials and well thought out process. You know, odd circumstances where you might get involved in these sort of things. You're not a surgeon just in the hospital, you know.
Dr. Lucas, you've had some experience in the rural setting. Is there anything that you would have done differently?
Well, yeah, you know, having practiced in Tennessee, I can definitely say there have been some times when all I had out in the farmhouse is a pitchfork and some hay, maybe a little pesticide, and my own gumption. You just got to work with what you got, and hope that things turn out all right.
Thank you, sir.
Another thing, Dr. Bruce, just because you were 11 in 1985, you think that means you don't have to know about it? You think that means you don't have to read? No, you have to read. So you can teach the interns on that wall over there what to do. Do you read at all? No. That's why we need to read about all these subjects, even if we were only 11 at that time. Excuse me, I got to take this.
Smooth. Can you pull up the Sony XP?
I'm sorry. Smooth.
I will go with that.
All right.
Someone
We're going to go from smooth.
Yeah, go ahead.
So was it smooth, or did you have because you kind of pan it back and forth, right?
Yeah, no, just start from smooth.
Are you going to give me the anesthetic?
Well,
Yeah, the answer is yes, okay? Because if you... There's always a diabetic working in a warehouse in 1985, right? Are they going to have some needles? Yeah, I think they are. Okay. All right.